So now we will proceed for the H4. Before going to the H4, we will proceed for the H7 and then we will move on to that particular point. So I think please all of you please come forward, then we will see that. So very crucial and high time to all of you to understand this concept. So H7 crease, the crease called as a first crease which is attaching to the wrist, that to be known as a first crease. On the crease the point is located, that to be known as a H7 on the crease. Now what I should do? So many people does a mistake this. This crease as a transverse crease of the wrist or the ventral crease of the wrist. This to be known as a ventral crease of the wrist. On the ventral side, now you touch and then feel. You come down from here, you can find the tendon. You come from this side, you can find the tendon. This tendon to be known as a flexor carpi ulnaris tendon. Now I'll repeat once again. From here there are the two muscles are origin. One muscle, these muscles are the flexor carpi ulnaris muscles. These muscles are flexor carpi radialis muscles. There are the two muscles are coming like this. These muscles comes like this. Then muscles will become tendon. So now this to be known as a flexor carpi ulnaris tendon. So this tendon inside, not the outside. So from that's the reason I'll tell you, you feel the tendon, you come from here, you can find the tendon. So tendons inside there is a depression. Otherwise you wanted to touch and then feel this side. From this side you just touch and feel this is the end of the wrist crease. From there come inside. This is the pinky finger. Pinky finger come this side. Because H9 point is located here, not here. This is SI1. This is H9. From the H9, the meridians, come upward direction, and this point to be known as a H7 point. So H7 again there are the two creases are here, but I just apply the inside of the tendon, this point to be known as a Shenmen. Yes, this point to be known as a Shenmen. This is the direction you can see, and also where I applied, but I'm not touching to the tendon, but inside the tendon. But most of the times obesity patients, you apply on the tendon, otherwise you apply on the medial side, but you don't apply on the radial side. Where exactly the point is located? In the depression on the radial side of the tendon of the flexor carpi ulnaris tendon, right? So therefore you need to apply radial side, means not this side, but towards the radial side is existing. If you apply on the medial side, means inside, this side to be known as a medial side, this is radial side. But the tendon radial side is applicable, but not on this tendon. The radialis tendon, no. Ulnaris tendon, on the radial side depression, you need to apply the needle. So hopefully you understand this is the H7. So once we know the H7 point, then from there 1.5 Chun proximal. We all know these points are the fundamental points, but still you wanted to recognize the appropriate location to treat for the many indications. Now I'll come to the H4 point, that is the Ling Dao. So where exactly is located? From here how many Chun? From here? This to be known as a 6 Chun, right? This to be known as a 6 Chun, and then from here to here, From here to here is 3 chun. From here to here is 1.5 chun. Now this spot to be known as a 1.5 chun. This spot to be known as a 1.5 chun. Then again it is 1.5 chun to half of chun. This is as a H4, H5, H6. Now you can recognize how closer each point, right? Because we have the very less space. If we do locate in this way, 3, 3, 6, then it is 9. Only the 9 chun we can recognize here if you measure like this. If you measure like this also 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can find in this way. I just covered from this region. But from here to here normally 9 chun. Then you cannot measure like this 1 chun, then 1.5 chun like this. But you can measure with the very small destination here by using the proportional measurement as well. So now we recognize the 1.5 chun proximal. 1.5 chun proximal to this H7 point. H4 point is located. H4 point is the C cleft point. Now I just apply all these points. One by one, 4 points we just apply, and let me see the indications. Now H4, I just applied inside of the tendon. Inside of the tendon. This is the C cleft point. C means is the cleft. Cleft means exactly there is kind of the open up or merging, emerging. So you remember this is the C cleft point for the 2 conditions. One, all the blood related disorders. What kind of the blood? Especially the heart related problem. The heart blood need to pump properly. If it is not pumping the blood, so that time need to increase the circulation of the blood. So that time certainly you can use the C cleft point to improve the overall activity of the cardiac system. When the blood flow is not good, or the hyperactivity of the blood, how many liters? I told you 6,000 to 7,500 liters of the blood pumping every day. How much? 6,000 to 7,000 approximately. The liters of the blood is pumping per day. Then how is important of our canal? The piping system how strong? Then the engine how is strong? Before birth it is started, it's never stopped till now. Even the single minute is not stopped over the circulation. Isn't it? How thankful, say thanks to him. So now we recognize this the point for the neurasthenia or the neuro-related problem or the mind-related problem or anything connected to the emotional impacted or the psychological problems or the blood-related issues. All the conditions can be used in. Suddenly the patient got the angina pain. Angina means the chest pain or the cardiac pain or the myocardial pain. Any kind of the emergency heart pain is happening to him. Then first point need to be activated. That to be known as a H4 point. You just use it linked out that having the great impact to treat for emergency control of the blood to pass to the cardiac system. Number 1. So again it is the patient is suddenly got the palpitation, but he is normal. Suddenly he got the palpitation, atrial fibrillation, something like that because of the some condition he got, or maybe the hole in the heart system, the hole, 2 holes in the heart. So normally the small hole and the other one is the big hole. That is the normally it happen in the congenital. So that situation you need not to emergency, you need to go and do the surgery, but you take the opinion of the cardiologist, but he is telling you yes we can do it later or may not be necessary, but slowly how we develop, our age get developed, our body get developed, that also is going to close the hole later future. Chances are there. If it is not closing, that will not harm the body. That's the reason better. That gets the bifurcation. That takes the collateral from one place to other place to blood flow and take the capillaries support, and then that blood flow can be happen easily. So hopefully we understand this good for the palpitation, insomnia and other all the cardiac related disorders. The next point to be known as a
Do
tungli.
we have any difference between high C point and big liver point, sir?
Yeah, I will tell you that as well. But now we will recognize the
Heart
point.
4 is Jing liver point, no, sir?
No, heart 4 is this heart 4.
Jing liver point.
Metal punching.
Oh, this H6 is the C cleft point. Yes, this is the H4 point. Really good, you have told me. But H4 is the point which is treating for the pulmonary system and also for the cardiac system. Any palpitation and any other related problem, this is the Ching river point. But any stagnation and blockages and also all the blood related disorders, you can use the Ching river point, that is the H4 point as well. But the H5 point we can use it. What I told you for so much for the C cleft point, for this condition, definitely you can use the H4 point as well. For all the cardiac related disorders, you can use the 4 points. 1, 2, 3, 4 points can be applicable. Now I just used another point is H5 tungli. So H5 is the tungli point, is the one shown proximal to the wrist crease from the H7. Exactly this point is located. What is the beauty of this point? Yes, nexary point, luvo connecting point, or the passage point, or the door point, or the interior and exterior point, or the husband and wife communicating point, a small intestine and then heart is connecting point. So therefore we recognize the H5 is the great point to treat for to regulate the cardiac system. Because you remember, whenever it's my clinical experience, the heart problem alone will not give the trouble to the heart until unless the wife or the husband will not get disturbed. You know, the small intestine also reason to cause the problem of the heart disorders. Therefore, what need to be done? Regulate to the both the system. So I recognize the point to be known as a tungli to treat for the GIT related disorders. Along with that is the cardiac related disorders. Most of the times all the cardiac doctors, they used to prescribe what? There is the proton pump inhibitor, H2 antagonist, or maybe the ranitidine, famotidine, pantoprazole. This combination normally they used to prescribe, that indicating that small intestine need to be regulated. So therefore you just use it. Tungli point is good point to communicating to small intestine and also for the heart as well. So by the way, this also distal point for the two conditions. One to be known as a distal point for the eye, then the distal point for the throat and also for the tongue. Because you know the tongue is the mirror of the heart. So all the tongue related problem, normally we have the tongue muscles, 8 different types of the tongue muscles and also different types of the papillae. Fungiform papillae, so many papillae are existing, but the tongue related problem can treatable by activating this point. Now you remember there is a ulcer, stomatitis, glossitis. Stomatitis means is the mucous membrane inside panparach, they eat and then the mucous membrane will get the damage. That's called as a stomatitis. Glossitis means inflammation of the tongue. So tongue related problem. There is the phlegm related problem. Phlegm, always you remember, there is any kind of the phlegm, the plaque which is existing in the cardiac system also to be known as a phlegm. That is the invisible phlegm. How the insubstantial phlegm. So that phlegm need to be regulated by activating this point also. Then the heat get excessiveness, all the phlegm. There is the cold phlegm, the other one is the heat phlegm. Remember the heat phlegm, it causes the problem of the tongue. So therefore anything the stomatitis, especially the glossitis, right? Glossitis having the problem, then you remember the tongue heat is excess because of the heart heat get excessiveness, the small intestine heat get excessiveness, it causing the problem. Normally says mouth ulcers because of the पेट में फोड़ा हो गया तो फिर यहाँ पे होता है. So you know the small intestine having the problem, that reflecting on the tongue as well. So hopefully you understand. And further the aphasia, speech related problem, especially the hemiplegia, paraplegia conditions, when there is the Broca's area is affected on the left side, then you treat the Tungli point as well. But however the hemiplegia happen on the right side, but the left side, remember right side hemiplegia is big problem, left side hemiplegia is okay, but stroke and then hemorrhage, that is something is different. The bleeding happen, that is a serious complication. The only the clot is there, blockage is there, that can be treatable. He will going to survive and happily and without any much complication. Now the problem is on the especially right side it's happened the hemiplegia. So that time Broca's area is going to affect the inferior margin of the inferior margin of the frontal lobe, that Broca's area is existing. So that Broca's area to be regulated, here you just target along with that Tungli point also activated. So give the command to both the sides. Give the brain command and also give the command on the here as well. So hopefully you understand. Further luvo connecting point.
Of the same side.
Yeah, same side or
Broca's
the
area and
you can use it bilaterally or the unilateral. I mean to say right side hemiplegia. Then use it on the left side, use it Tungli, or you wanted to use on the right side also, there is no harm, you can use it. So bilaterally you just use it, that one or other way will be good, but Broca's area use it only on the right side. Broca's area only on the, use it on the left side, left side. But again it is depend on the person. For example, right-handed person works on the left side, left-handed person works on the right side. So likewise the tremors also same. So anything the cardiac problem, anything is there, right-handed cramps, in the cramps, righter cramps is there, where I am unable to write, I am unable to hold. So that time it depends on the right-handed person or the left-handed person. It works in the opposite level. So hopefully you know that is the H5 point is great point to treat for the vision related problem as well. Vision means what it comes to your mind.
It's fine.
Yes, the chest problem is the distal point is P6 you know, but the distal point for the eyes is H5. Also keep it in the mind, no doubt Kwang Ming means GB37, also the distal point for the ophthalmic related disorders. No problem, you just use it in this way. Then further the most important point which I told you, there is a in C. I am just inserting the half tune proximal to the H7, that to be known as a in C. So that means is the emergency point or the C cleft point which I told you. The C cleft point is the most important point to emergency control of that organ, right? So therefore all the blood is not pumping properly, that time you just use it. And also the perspiration, profuse sweating. Normally what happened due to the heart related problem, the sweating taken place on the face region or on the arm. So that time what you should do, use the H6 point for emergency to control the sweating and also to control the cardiac system. We can use it. By the way, in the night time especially they get the sweat a lot. So that time we can use some of the points. One point is H6, the second point to be known as a K7 folio. So especially the night time getting the sweating, even will ask one question in your examination, what are the points for the night sweating? So that time we can use these points is always is good. The third, the seventh point to be known as a Shenmen. So the last, the wrist point, last wrist point to be known as a Shenmen, H7. So H7 point is just, I told you, the on the transverse crease of the wrist, the medial side of the tendon, the point is located, but all the points are located on the medial side of the tendon. The points are located here, right? Now the Shenmen is the spirit, and then men means is the door. So here normally says is the God's door or the door of the heaven normally says, but all the this point belongs to the source point, and also this point is the sun point. This is the source point and also it is the sun point and sedative point. So therefore we can use it, this point, for the numerous conditions we can use it. H7 is the great point whenever there is the cardiac problem or the non-cardiac problem. Normally I used to apply this point for the most of the patient to calm down the stress level. When we apply the 2 points, so one is you just use it as a pai hui. You just use it as a pai hui, and then H7. So one is the cosmic energy, the other one is the heart energy. Cosmic energy is flowing on the sky level, on the cosmological level, that entering to the Sahasrara chakra. The other one is, this is as a soft copy, the other one is the hard copy. You are giving the antenna to 2 places to connect to that, right? And then once you treat by using these 2 points, it's which is my clinical experience, that calm down to the mental system, calm down and relaxing to the mind system. Today you all know that the people are living with the stress from the child to the geriatric level, right? From the birth to after he get the maturity, maybe first standard. From the first standard to at the age of 90 years of the old man, also suffering due to some kind of this stress. So that stress to be regulated by activating these 2 points is always good to calm down, to induce the natural sleep. So whenever there is anxiety, whenever there is a depression, or when there is some kind of the other psychological related disorders, obviously we can use these 2 points is good. Remember another triangle is there, that is the Buddha's triangle, that also has 7, one of the point in that. So we can use this point, but for the numerous diseases, known and unknown cases of the cardiac disorders, or some other related problem also we can use it for generally. H7, DO20. Now we will treat, so now we understand this particular H4, H5 and then H6 and then H7. So according to the mitral valve and also tricuspid valve I told you, and further what indications we can use it. Myocardium related problem, the muscle related problem, especially the cardiac muscle need to be activated. On that situation you can use the 1 point, that to be known as a H6 point. H6 point to treat for the myocardium, that is the cardiac muscle to be regulated. If the cardiac muscle is good, the heart pumping will be good. So therefore now H5 and also H4 point. This point also treat for the overall for the right and left coronary arteries to be regulated. But however this H7 point is good point to treat for the conductive system. Conduction means the SCA node, I told you, SCA node, AV node, bundle of his Purkinje fibers, but all the fibers to be regulated. The heartbeat, either it is the tachycardia or the bradycardia, the normal heart rate level can be taken place by activating the H7 point. Whenever you feel that there is a problem, that means heartbeats get abruptly increases. So that time, even in the night time also heartbeat get excessiveness. That time you can use the H7 to control the conductive system, right? So hopefully right and left bilaterally you can use it, or the unilateral also advisable. Now the point to be known as a H8 point.
So how much tune, how much deep we can needle?
Yeah, half tune you just use it. Now there are the 2 locations are there for the H8. Remember all of you, there are the 2 locations for the H8, but both the functions are more or less the same. I just apply now.
So from H4 to H7, heart 4 to heart 7, it would be 0.5 tune only?
Yes. Take deep breath. Just take the deep breath. Half tune. So there are the two locations I told you. One location to be known as a H8, H8.1, but the entire region to be cardiac system. The entire region to be known as a cardiac system. Now either you can use this both the points or the single point. Remember, this is the key point to all of you. If you apply this any one point or the 2 points, this also it is the horary point, and also this is treating for the right side is treating for the tricuspid wall, left side is treating for the bicuspid wall. Right side tricuspid wall, that means that's treating for the pulmonary system and also for the cardiac system. But this purely treating for the especially for the cardiac system. Oxygenated blood need to be followed. So that time you can use it on the left side is more predominantly good if you are treating only for the heart. Better you wanted to use bilaterally because both the side is very important. You can use it bilaterally. Now we can activate this point as a tonification way. This you are treating to the tricuspid wall. Right side, left side is?
Bicuspid.
Yes, bicuspid wall. Bi means is the 2, tri means is the 3. 3 walls are there here to open because lot of blood is coming. The inferior vena cava and superior vena cava need to drain that. That's the reason that is tricuspid. This is the bicuspid wall. Then at the last you wanted to use coronary arteries, only coronary arteries you wanted to treat. So that time along with that I recommend you the another point is the pericardium 7 point to treat for the pericardium 7. You just apply the pericardium 7 point. Yes. Pericardium 7. Yes, pericardium 7. And also there is a H8, P8. These points will be really helpful for what condition? Overall for the coronary arteries and also to the all the heart related disorders. Only these points you just apply, that will regulate for the overall health of the cardiac system in generally. Now we understand the last point, but it is
initially you told L9 also.
Yes.
For the arteries only.
Yeah, arteries for the blood vessels. That is the influential point for the blood. The specific blood related disorders, we can use the LU9 point. You know there are the 8 influential points are there. Among them one point to be known as a LU9 to treat for all the vascular disorders. But this only for the vessels of the heart I told you. But this is vessels for the overall. But however, you know, heart is good, but all the blood vessels also good. But you wanted to add up the another point, LU9, that's really supportive point, that also one or other way is good. By the way, I just applied one more point for this to overall treat for the lungs as well and also treat for the heart as well. Now the last point we recognize.
Sir, please show once again the heart rate position, how we can locate it, heart rate.
Yeah, show me one second.
Sir, because of the fairness, the light is reflecting.
Yes,
So
sir.
the exact location is not being seen.
Now you can see, you do like this, you show me. You do like this. When it touches the 2 fingers, ring finger and then pinky finger. So exactly in the center, that to be known as a H8 is the one location. But anatomically where this point is located. Anatomical location is different when you do it like this, but it shows the point is here. But midway between the 2 creases, you come like this is the web margin. This point to be known as a H8. From the web margin you come upward direction. From the web margin you come where? From here you just come down midway between the 2. This is as a H8. Now the another H8 is you press and then come here where it ends of the the fourth and fifth metacarpal bones where it starts, that area to be known as a H8. H8.1. H8.1. If you apply these 2 points, really great point to treat for the heart disorders. You
Sir,
give
show
the
the
pressure.
Can you show the needling at that point so we can see it clearly?
Now,
I got it.
yeah.
It's shining. Palm. Ah, yes, sir. Okay.
Now the last point is H9.
One tune difference from between 2 points.
Yeah, approximately 1 tune, but I don't say in that way 1 tune. But here is the proper location is very important. But however you think like that. Now H9 point. So now I applied the H9 point tonification. I have done the tonification. But towards the energy flow, if you apply this direction,
Sir, all heart meridian point always tonification, no, sir?
no, not like that. See, one is the tonified, the other point is sedated here. Right? This is as it towards the pinky finger downwards direction, tonification. Upward is sedation. Same point. But however, this if you apply 3 points together, so this is normally I generally apply sometimes. So 3 points. This is I think Prof.Samiullah's technique. Already I uploaded in the YouTube channel, but nowhere you can find. But this is get the neutralization. 3 points. One is the tonification, other one is the sedation, the other one is the perpendicular direction. H9 used to treat for the known and unknown cases of the cardiac related disorders. But now I applied on the left side of the pinky finger, but left side of the pinky finger treatable for the aorta, and then right side of the pinky finger treatable for the which wall? Pulmonary wall. I just apply the perpendicular, but this treatable for the pulmonary wall, this treatable for the aortic wall. So therefore both the sides you apply, but both the sides the heart to be regulated in order to get the optimistic level. Hopefully you understand this. This is also good for the angina pain, but especially the patient will get the pain. On that time you can use the H6 point and then H9 point and also LU11 point to control the emergency heart pain. Right? Thank you.